Now, we use oral methotrexate a lot, or at least I do, particularly a couple years ago because there were problems with the sub-Q dosing. In a weird way, we're already extrapolating because the original clinical trials were with an IM dose and we're already giving sub-Q. And this was an interesting study looking at the bioavailability of oral methotrexate. And what you see that it's only slightly less than parenteral therapy. So what you see here in the bottom that these are 11 patients. And the ratio here is they were given sub-Q or oral. And what you see here, for example, patient 1, the oral dose is 77% of the dosing, the amount available in the blood, than the subcutaneous dosing. So number 2 would be 81%. You can see that patient 7, the oral worked better than the sub-Q. And so there's 2 ways of thinking about this graph. Number 1 is that what this study tried to show is that if you average all of these, the average bioequivalence is about 86%, which is only slightly less than the 90% bioequivalence that would be mandated by the FDA to say that the drugs are equal. Another way is just simply to say, you know what, we already know that the oral dose is going to be less than the sub-Q dose, but the fact is because of convenience, we're maybe willing to accept it. And if you had to kind of pick a number, I would say probably at about 80% of the sub-Q dose. So I think if we understand that, we know what we're getting when we move to oral methotrexate.